Hi, Sally. My name's Emily.
Hi.
How are you doing today?
Good. How are you?
I'm doing well, thank you. So I'm the OT that works at your daughter's school, and I'm going to talk with you about some of her um, sensory input and how she reacts in different scenarios using this SPM. It's the sensory processing measure. So what we're going to do is I'm going to ask you a bunch of questions about her social participation, her vision, her hearing, her touch, taste and smell, body awareness, balance and motion, and planning and ideas. So I'm going to have you answer the question based off of a scale. And the scale is never, occasionally, frequently, or always. Answer the question to the best of your ability. And if you are unsure, you can make your best guess or ask a clarifying question.
Okay.
It should take about 15 to 20 minutes to complete. If you're not comfortable with answering any questions at this time, we can leave them blank and come back to them at the end. That's about it. Do you have any questions before we start?
No.
Okay. So before I start asking the questions, I'm going to have you verify your relationship to the child. So your mom. Also, what is your child's age? How old is your child?
She's 11.
She's 11. And what grade is she going into?
She's going into 5th grade.
5th grade. Okay. All right. So the first set of questions is based on social participation. Does your child play with friends cooperatively without lots of arguments?
Sometimes.
So would you say like occasionally or frequently?
Occasionally, I would say.
Does your child interact appropriately with parents and other significant adults? For example, communicates well, follows directions, shows respect?
Always.
Always. Does your child share things when asked?
Occasionally.
Does your child carry on a conversation without standing or sitting too close to others?
Always.
Does your child maintain appropriate eye contact during conversation?
Always.
Does your child join and play with others without being disruptive or disrupting the ongoing activity?
Always.
Does your child take part in appropriate mealtime conversation and interaction?
Frequently.
Does your child participate appropriately in family outings, such as dining out or going to a park, museum, or movie?
Always.
Does your child participate appropriately in family gatherings, such as holidays, weddings, and birthdays?
Frequently.
Does your child participate appropriately in activities with friends, such as parties, going to the mall, riding bikes, skateboards, scooters?
Occasionally.
Okay. So that was all the questions for social participation. Next, I'm going to ask about vision. Does your child seem bothered by light, especially bright lights that are blinking? Or does she blink, squint, cry, close her eyes in response?
Frequently.
Does your child have trouble finding an object when it is part of a group of other things?
Never.
Does your child become distressed in unusual visual environments, such as bright light, colorful room, or a dimly lit room?
Always.
Does your child have difficulty controlling eye movement when following objects like a ball with her eyes?
Occasionally.
Does your child have difficulty recognizing how objects are similar or different based on their color, shapes, and sizes?
Never.
Does your child enjoy watching objects spin or move more than most kids her age?
I would say occasionally.
Does your child walk into objects or people as if they were not there?
Never.
Does your child like to flip light switches on and off repeatedly?
Never.
Does your child dislike certain types of lighting, such as midday sun, strobe lights, flickering lights, or fluorescent lights?
Would you repeat that question, please?
Absolutely. Does your child dislike certain types of lighting, such as midday sun, strobe lights, flickering lights, or fluorescent lights?
Midday light.
Midday
Yeah,
light.
like often.
Often. Does your child enjoy looking at moving objects out of the corner of her eye?
Never.
Never. Okay, so now we're going to move on to hearing.
Mhm.
Does your child seem bothered by ordinary household sounds such as the vacuum cleaner, the hairdryer, or the toilet flushing?
Never.
Does your child respond negatively to loud noises by running away, crying, or holding hands over her ears?
Never.
Does your child appear not to hear certain sounds?
Well, I call her sometimes. But, never, I would say.
Never. Does your child seem disturbed by or intensely interested in sounds not usually noticed by other people?
Never.
Does your child seem frightened of sounds that do not usually cause distress in other kids her age?
Never.
Does your child seem easily distracted by background noises such as a lawnmower outside, an air conditioner, a refrigerator, or fluorescent lights?
Never.
Does your child like to cause certain sounds to happen over and over again, such as repeatedly flushing the toilet?
Never.
Does your child show distress at shrill or brassy sounds, such as whistles, party noisemakers, flutes, or trumpets?
Occasionally.
Awesome. All right. So now I'm going to ask you some questions about touch. Does your child pull away from being touched lightly?
Never.
Does your child seem to lack normal awareness of being touched?
Never.
Does your child become distressed by the feel of new clothes?
Never.
Does your child prefer to touch rather than to be touched?
Not that I know of. That I will say never. I never.
Okay. Does your child become distressed by having her fingernails or toenails cut?
Never.
Does your child seem bothered when somebody touches her face?
Occasionally.
Does your child avoid touching or playing with finger paint, paste, sand, clay, mud, glue, or other messy items?
Never.
Does your child have an unusually high tolerance for pain?
Never.
Does your child dislike teeth brushing more than most kids her age?
Never.
Does your child seem to enjoy sensations that should be painful, such as crashing onto the floor or hitting her own body?
Never.
Does your child have trouble finding things in a pocket bag, or backpack using touch only without looking?
Never.
Okay, so that was it for touch. We're going to move on to taste and smell. Does your child like to taste non-food items such as glue or paint?
Never.
Does your child gag at the thought of an unappealing food such as cooked spinach?
Occasionally.
Does your child like to smell non-food objects and people?
Never.
Does your child show distress at smells that other children do not notice?
Never.
Does your child seem to ignore or not notice strong odors that other children react to?
Never.
So we're going to move on to body awareness. Does your child grasp objects such as a pencil or spoon so tightly that it is difficult to use the object?
Never.
Does your child seem driven to seek activities such as pushing, pulling, dragging, lifting, and jumping?
Never.
Does your child seem unsure of how far to raise or lower the body during movement, such as sitting down or stepping over an object?
Never.
Does your child grab or grasp objects, such as a pencil or spoon, so loosely that it is difficult to use the object?
Never.
Does your child seem to exert too much pressure for the task, such as walking heavily, slamming doors, or pressing too hard when using pencils or crayons?
Never.
Does your child jump a lot?
To play sports, yeah.
So would you say
I will say frequently.
frequently?
Mhm.
Does your child tend to pet animals with too much force?
Never.
Does your child bump or push other children?
Never.
Does your child chew on toys, clothes, or other objects more than other children?
Never.
Does your child break things from pressing or pushing too hard on them?
Never.
Okay. So now I'm going to ask questions about balance and motion. Does your child seem excessively fearful of movement, such as going up and down stairs, or riding swings, teeter-totters, slides, or other playground equipment?
I lost you there. Can you repeat the question, please?
Absolutely. Does your child seem excessively fearful of movement, such as going up and down stairs, or riding swings, teeter-totters, slides, or other playground equipment?
No.
So
Never.
Never. Okay. Does your child have good balance?
Always.
Always. Does your child avoid balance activities such as walking on curbs or uneven ground?
Never.
Does your child fall out of a chair when shifting his or her body?
Never.
Does your child fail to catch herself when falling?
Never.
Okay. We have 2 more questions and we'll wrap up for today.
Okay.
All right. So does your child seem not to get dizzy when others usually do?
Occasionally.
Occasionally. All right. And lastly, does your child spin and whirl his or her body more than other children?
No. Never.
Okay. All right. Thank you for answering all those questions. I know it's a lot.
My pleasure.
So I'm going to go through and score this. And once I come up with a score, we can determine a time to talk about the scores and see if we need to make any adjustments and go from there.
Okay.
Do you have any questions?
No, it was straightforward.
Awesome.
Thank you.
Thank you so much. Have a good day.
Thank you. You too.